welcome to part two of our webinar on smoke-free tribal casinos. Part one was moderated by my colleague, Natalie Hemmerich, and you may notice that I'm not Natalie Hemmerich. Unfortunately, she had a colleague, so I'm sort of a last-minute sub as the moderator here. My name is Mike Freiberg. I'm a senior staff attorney with the Public Health Law Center, and it's an honor to be a part of this webinar. So as I said, this is part two of our webinar on smoke-free casinos for California tribal communities. I won't go into a great level of detail about who we are as the Law and Policy Partnership to End the Commercial Tobacco Epidemic and the Public Health Law Center. Natalie already covered those in our last, in part one of this. So just wanted to kind of fly through these really quickly. We're located on at the Mitchell Hamlin College of Law in St. Paul, Minnesota. And I mentioned, and Natalie covered this as well, but we do acknowledge our presence is in the tribal and treaty homelands of the Dakota Oyate since time immemorial. The lands are home to the Sisseton, Wahpeton, Mdewakanton, and Wapekute Dakota peoples. The land acknowledgement that we put on our website was developed by the Native American Law and Sovereignty Institute at the Mitchell Hamlin School of Law and is being used with permission. But for more information on Indigenous peoples in these tribal lands where we are located, we encourage you to visit our website. So Natalie covered how we are kind of guided by thinking about the social determinants of health. And this is a pretty savvy crowd, so I won't go into that in great detail. She also covered kind of what legal technical assistance is and how it is distinct from legal representation or lobbying, which are two things we don't do, but feel free to reach out to any of us at any point if you have any questions. Here's what we'll cover today. We'll have sort of an opening blessing by Nicole Graumann, as she was very kind enough to do this again as she did last time. Clinton will, he had some material that he didn't get to during part one, really talking about a survey that he did that's got some very compelling data. But a majority of the time will be Q&A. We do have an hour reserved for this. Don't know if we'll need the whole time, but we do want to make sure we get to everyone's questions. And there were a few questions that I have from last time that we didn't have the time to get to as well. And I'll share some resources as well. We're fortunate enough to get the same fantastic group of presenters back here. So actually these are the resources I had. So I will stop sharing. I'll turn it over to Nicole to give the opening blessing. So thank you again for being here.
Thank you, Mike. You will find this, I'm going to do just a little talk before I do the blessing, but it's very important for Native people, Olin, Clinton, myself, is that we start all of our blessing, all of our work that we do in our spaces with a blessing or a prayer, asking for Creator to please bless those who are here. Let what needs to be said, let what needs to be heard, and more importantly, what needs to be understood, to be understood. My name is Nicole Graumann. As Mike said, I am Pomo from the Redwood Valley Rancheria in Northern California. I was lucky enough, very few Indigenous in California was lucky enough to be Native their whole life due to termination. I am one of those lucky individuals who has gotten to be Native for my whole life, and I am 40. So just put that into frame of reference. I've got to be Native my whole life, despite my creation story of my people. I am descended from Lake County, Pomo, as well as here in Mendocino County. I am a descendant of a boarding school survivor. My great-grandmother was taken from here in Mendocino County when she was 6, and she came back when she was 19. So the fact that Olin, Clinton, all of us who have any cultural identity maintain that identity is because we are the children of survivors. And so all of that colors our work and how we proceed. And I just want to thank all of you for coming to listen, opening this space in a good way. There is never a dumb question when it comes to Indigenous because our communities live parallel. They should not live parallel anymore. And that's what you all are here to listen to. And it is my distinct honor to be able to open this for Clinton and for Olin and for us to answer those questions. So again, Creator asks that you be here with us in this space and learn and grow with these people and the knowledge that they hope for. So thank you so much.
Thank you, Nicole. I really appreciate it. So now I'll turn it over to Clinton Isham, who will discuss the results of a survey of casino patrons. So take it away, Clinton.
Okay. So I'm gonna share a portion of my screen. Hopefully that works out. Is that okay? All right. Well, thank you guys so much for having me back. My name is Clinton Isham. I work as the Tribal Relations Consultant for American Nonsmokers Rights Foundation, and we're a public health nonprofit advocacy organization that helps with smoke-free policies and different public health campaigns move forward throughout the U.S. and within tribal areas. So I discussed the last time I was here on the webinar, some of the things about the casino patron survey that we did recently. What I was hoping to do today is just to provide some more background information and how we came about developing this survey and the importance of it, and like the importance of the things that we built off of in order to get to where we're at now, in hopes of like continuing this momentum and really like handing over these tools and resources to everybody on this call so that you could continue this work within your communities. And so I just wanted to start with my work advocating for smoke-free casinos and spaces. Tribal areas began in 2015 when I was hired as the program director for the Wisconsin Native American Tobacco Network, which is out of Great Lakes Intertribal Council. And Great Lakes Intertribal Council is kind of like this organization that serves all of the Wisconsin tribes, the 11 Wisconsin tribes. And my job was really just to provide, commercial tobacco control funding and resources, and provide funding to like cessation services and things like that. So I worked closely with the 11 tribes, which are very different as far as like history, culture, and sovereignty goes within each tribal community in Wisconsin. And so I was, fortunate enough to like learn so much about that. Even though I'm from Wisconsin, I'm from Lac du Flambeau, I learned a lot in my 5 years working there with tribes. When I first started working at Great Lakes Intertribal Council around the same time when I first began, the Tribal Epidemiology Center in our office had just produced this groundbreaking report on smoking preferences at our local tribal casino, which is called Lake of the Torches Resort Casino. The survey was titled Gambling with Our Health. It was co-written and administered by Shaniqua Isaiah Broken Leg, who's a Lakota tribal member. And I think she works for the Episcopal Church now, but for many years was working as a public health advocate for the Tribal Epidemiology Center out of Great Lakes Intertribal Council. And so this survey is really important, and I'm going to talk about it in the next 20 minutes a lot and bring it up a lot because of its significance. But Isaiah collaborated with Lake of the Torches Resort Casino in 2014, that time, and they asked to survey their player club card members, their card holding player club members. And they wanted to ask whether or not the patrons would stay longer at any given machine if Lake of the Torches Resort Casino was smoke free. And at this time, Lake of the Torches was not smoke free. And what Lake of the Torches did was they offered their player club members free play in order to answer the survey questions. And so Isaiah worked with the casino in putting in the survey questions into a computer system, and where patrons were allowed to answer a number of questions, and then they would be gifted free play to play at the casino. So it was very, ingenious way to have these survey questions answered. And the survey found that all respondents preferred a smoke-free gaming floor, and the data suggested that Lake of the Torches would earn more money if it was smoke-free. And so this conclusion was made due to higher tier player club members. So people that were earning more money, they stated that they would stay at the casino longer, that they would play longer. There would be an increase in coin at any given machine if the gaming floor was smoke-free. And this survey is available online for free if you just look it up, Gambling with Our Health. Again, it's from 2014. I share this survey, Gambling with Our Health, because it was really like ahead of its time, and it helped add a lot of momentum to a snowball effect that took place when a number of casinos was going smoke-free during the pandemic in 2020. At the time when Gambling with Our Health was released, there was only a handful of smoke-free tribal casinos in the United States. There was one in New York, I think one in California, one in maybe New Mexico. There was like maybe 3 or 4. And at the time, when I started working with Great Lakes and with Isaiah, we used this survey, the data, to advocate for smoke-free gaming all over the place. We went to a number of different tribes, and we advocated that, your casino would earn more money. Would you go smoke-free? But no one thought at the time that cutting out smoking at the casinos would work, because the narrative, and still part of the narrative today, but I think it's a lot less so, is that like smoking and gambling go hand in hand, and the two must stay together, and it will not work if, smoking is out of the equation. And, we were pitching this idea all over the place, including at Lake of the Torches Casino, where we collected the data, where the survey was administered. And we met with the Lac Definable Tribal Council in 2015. We presented the data, and we shared that if the casino would go smoke-free, that it would earn more revenue. And what the casino did instead of passing a policy was they installed these multi-million-dollar air filtration systems on top of the roofs that, we all know that do not work. There was one casino that did go smoke-free based off these recommendations that was in this report. And it was Ho-Chunk Gaming Madison. They went smoke-free around 2015, and I wanted to make it my mission to learn everything about that decision-making process, and also to share its impact and share the results of what happened there. And so I was able to get a meeting with the executive director of Ho-Chunk Gaming Madison, who's Dan Brown, who's in this photo here, in 2016. And when I first met with Dan Brown, I sat down with him. There was a printed copy of Gambling with Our Health report on his desk. And he told me that he read this report and it just made sense to him. And he didn't understand why any tribal casino wouldn't want to try to go smoke-free, especially if in the report it says that you'd earn more money. And so, in the few years that followed this meeting with Dan Brown, he reported that everything in the Gambling with Our Health report was, basically true for Ho-Chunk Gaming Madison, that there was a small decline of revenue in the first 6 months of going smoke-free. There was a new clientele that was spending more money, and the casino was earning a lot more revenue, actually becoming the Ho-Chunk Nation's flagship casino. And if you want to know more about this process and directly from Dan Brown, we have a video that we did with American Public Health Association and the CDC in 2016, 2017, and the link is here, and I could send it to you guys. But we go into detail about talking about this process. And what went to follow all this was just, really organizing with Dan Brown and, having events to highlight what was happening there and sharing it with other casinos and making sure that other casinos understood what was going on and promoting smoke-free casinos. So fast forward to the pandemic, like I said, we used everything that was built in the past, from like surveys, from videos, all our work with Dan Brown and other casinos, to just promote the importance of casinos reopening smoke-free. Many of our organizations, including Public Health Law Center, American Indian Cancer, a bunch of different organizations, ANR, Black Hills, we worked together really closely during the pandemic, really just to highlight a lot of these casinos that were reopening smoke-free on their own will, right? Based off of their own decision-making process. And we wanted to just like create as much noise and as much activity as possible in an effort more casinos would go smoke-free, like hoping that more casinos would go smoke-free. And this really just helped like build the momentum, and we were able to like just keep on building on a lot of this. We ended up developing a ton more webinars. We created a Reclaim Sacred Tobacco Coalition, and it led us to like gathering more data from like patron-led surveys, in which I'll talk about now. Including the most recent data that we collected last year. So over the course of time during the pandemic, over 160 tribal casinos had reopened smoke-free. And when we met with tribal leaders to pass policies for casinos to remain smoke-free, working with tribal communities that wanted their casinos to remain smoke-free, we would go to these tribal council meetings. And a lot of times the tribal leaders shared that their decisions were influenced heavily by Dan Brown, the video that we shared, or just presentations that we had Dan Brown on, and the Gambling with Our Health report. So it just shows like before all this, right, there was less than 5 tribal casinos that went smoke-free. But of course, we had this huge shift of things that were happening with the pandemic, but we used all these resources and all these tools and highlighting all these good things that were happening. And, and from that, over 160 tribal casinos went smoke-free. And of course, not all casinos remain smoke-free. During the pandemic, we were promoting the importance of like self-determination and the right to tribal sovereignty. So we weren't like demanding tribal leaders to go smoke-free or to make casinos smoke-free, right? Like tribal leaders have been running their casinos since the 70s, 80s, on their own will, doing their own thing very successfully. This is a $40 billion industry, right? It's like, who the heck am I to come in and tell you what to do, right? And so our tactic was always to like promote self-determination, to promote the right to tribal sovereignty. And we just wanted to focusing on the health and financial benefits of smoke-free casinos. And so it was definitely frustrating when casinos were going smoke-free, reverting back to allowing smoking, I was getting a lot of calls from different tribal organizations, from a lot of tribal communities, wondering what they could do, how we could have these casinos go back to not allowing smoking. And our approach has always been to remain respectful, to remain non-confrontational. And we've done this through surveys, through patron-led surveys. One of the first patron-led surveys that we did was with Brian Christopher, who is very like popular and I would say famous, a social media influencer. Early on, we were doing surveys through his fan club called Rudy's Fan Club, and we were asking patrons really, what they thought about smoke-free policies during the pandemic, whether or not they agreed with them. And a majority of the people that responded to the Rudy's surveys was, that people wanted smoke-free casinos, and that even non-smokers wanted smoke-free casinos. But what was going on was we were still getting a lot of, here and there tribal sites that were reverting back to smoking. And again, tribal communities wanted to know what we can do. And so what we did was we designed a patron-led survey, kind of like a template that a tribal community could use in order to survey within their own community. And what we did was we kind of did a national data collection process first, just to show organizations and coalitions how it could be used. And so in 2024, I partnered again with BC Slots, but we created a survey that would help get a tribal perspective included. And so that when we share it with tribal leaders, there would be something that they can relate to, something that they would be more interested in, and have it, be more like tribal friendly, have tribal language in it and things like that. And so we developed this survey in 2024 with BC Slots, and we started with our dissemination process. And this is not an academic survey. This is really just putting it online and hoping that people won't answer the questions twice. And so, but it is available, for use. And I think I just want to go back to saying it's really meant for organizations and communities to survey their own communities, right? We have templates available where if a tribe or organization wanted to engage within their own patrons, their own player club card members, their own community, they could have these questions available, and we could, be able to we'd be able to work with them to design the survey if they would like. So for this national survey that we did, we had over 2,000 people that responded, and we had a sample of around 10% tribal people that responded. Let me check my time. So again, a majority of the results, a majority of the people that responded to this survey said that they preferred to go to smoke-free casinos. An interesting question that we asked in the survey was, we asked about factor choice. We asked the respondents, what is the number one factor for you to decide what casino you go to? Is it distance? Is it cleanliness? Is it payout ratio? Is it the restaurants? Is it free play? Why do you choose to go to the casino that you go to? And for a long time, working with the casino industry, it's always been, for me, I've always learned that it's distance. That's the number one thing that matters. People will go to the closest casino. And so what we found here was that the number one choice for people was that the casino was 100% smoke-free, followed by casino cleanliness. And so, this is so important because it really like smashes the norm of what casino operators have thought to be, the norm traditionally. And so when we go in with this type of information and share with our tribal leaders and share with our tribal operators that, like, hey, people really don't go to casinos to smoke. People really, they would actually stay longer if it wasn't smoke free. And the number one reason why people choose to go to casinos is because, they're 100% smoke free. Another thing that we found out was specifically from tribal people that responded that they identified as tribal members was, again, that they preferred to play at 100% smoke-free casinos, and a majority of them had responded that they use or view tobacco for traditional purposes. And so again, this is really important if you're working within tribal communities to discuss the importance of traditional tobacco and the importance of, like, also, in thinking about things like the end game of tobacco in tribal communities, traditional tobacco for us is so important, right? It's like we're not trying to end tobacco in our communities. We want to restore tobacco back into our communities, to reclaim parts of that culture that was lost, and that's still part of our communities, but that we want to fully reclaim. And so it's important to have these conversations, both with tribal people and non-tribal people. And so again, we have this survey available, that infographic for people to use and to share. And another thing that we put on the survey was a QR code that leads directly to the survey questions. And so what we wanted was something easy to share with tribal leaders, casino operators. And a lot of times, especially when I go and present data in front of tribal leaders, they're going to want to know where the information came from. And, sometimes they won't really care if the data didn't come from their community. And so this is a really good tool and resource to have and to share with tribal leaders and say, okay, well, hey, we could do the survey right here in your community then. If you want, you could have us, survey the community. We could, share the data only with you to see what people think of smoking in casinos. And of course, it would vary in different places. Madison is a highly educated liberal city, and the survey data would look different than, a town that is not Madison, Wisconsin. Okay. Well, that's, I think, all I have for now. I hope I didn't cut out again. I think I'm still on, but if you guys have any questions or would like me to go over anything again, I'd be glad to help with that.
Yeah, that was great. And you didn't cut out there or anything. So
Great.
thank you it's great information. Thank you for presenting it. So we do have some questions that were submitted last time that we didn't have time to get to. So I'll turn to those now. If anyone has any other questions, though, feel free to put them either in the chat or in the Q&A using the Q&A button at the bottom, and we'll get to yours as well. So the first question I think might relate to some of the materials that Olin presented during part one of the webinar. Somebody submitted a question in April asking what the difference was between rancherias and reservations in California.
Well, good morning, everyone. Before I answer the question, I just wanted to extend my gratitude for all of the work the county and the other state or whoever's online today. If you're working in the Native community, thank you so much for all that you do for our people. Truly, it's an honor to be able to present information to you all, and to be joined by this wonderful panel is an honor also. So the difference between a reservation and a rancheria, it's pretty simple. If you want to research it, there is quite a bit of history around the rancherias in California, and California is pretty much, it's the only place you're going to find a rancheria. But the main difference between the two is going to be that a rancheria has set up for a family or an extended family way back when, and it required a smaller amount of space. And if you actually trace the name rancheria, it goes back to the days of the missions, when the Spanish were the dominant culture over the natives in California. It's a pretty sad time for them, but I'll let you do your own research. But again, a rancheria is the same as a reservation, except it's smaller, and it's trust land. It has the same jurisdictional boundaries and authorities that a big reservation would have, but they're essentially the same, and it's the place where Native Americans can have their own independent jurisdictional governing bodies. It's where their self-determination is applied, where their tribal elections occur, and it's essentially the same. Just one is smaller, one's bigger. But there is a lot more to it. I'm giving you the Reader's Digest version, but please research it. And if you're going to be working in Indian country, and I think if you want to impress folks, have a little bit of knowledge about reservations and rancherias, and that's a great way to start a conversation.
Thank you. That's great. Nicole, I see you unmuted yourself too.
Yeah, I'm also come from a rancheria, Red Valley Rancheria, and like Olin said, rancherias are normally occurring. A lot of us in Northern California use rancheria after Tilly Hardwick was a little tiny pomo lady who worked really hard in Northern California to get a lot of our tribes reinstated here in Northern California. So a lot of us go by our traditional names, which is rancherias, because a lot of the reservation locations, especially my reservation location, used to be on native groups of families who used to work for a specific ranch or farmer or rancheria. So my reservation is Redwood Valley Rancheria because all of our family groupings worked for one particular rancher here in Mendocino County. So when they came back through after the Tilly Hardwick decision and they started reinstating tribes, it was easier for us to form family groupings to reestablish tribes. So we go by the more traditional rancheria because that was where a lot of our housing came from, is because several families worked on a rancheria and we were all created together. So it's more family grouping tribes than gathered tribes like you see with some like Round Valley Tribal, or Round Valley Tribe is a collection of tribes. Hoopa is also a collection of tribes in that area. These smaller tribes rancherias are more likely family groupings that link our generational lineage to one set of family members or one set of brothers or those kinds of things. So
Thank you. That's very helpful. So the next question, has been covered a bit, but if anyone would like to provide some additional examples, I think that anyone could handle this. Just the question is, what are some of the challenges and barriers to adopting smoke-free casino policies?
Go ahead, Clinton.
You go ahead, Olin.
Well, I think after some work in California around this topic, I made the rounds quite a bit with the tribal casinos and talking to them about going smokeless. And it was my impression that it was mostly a commercial decision based upon money, people coming in the door, and tribes did not want to be telling folks to not smoke. And they felt if they were telling them this is a smoke-free casino, they felt there was a risk to the profit, to the bottom line. So that's my takeaway. And I did work with most of the casino managers in the state, and that was the easy, blunt answer is we're afraid of the bottom line, and if we touch the bottom line, our tribal population, the ones that we answer to, probably will not be very happy with us.
Clinton, what have you found successful in getting, the data out there that, there is increased or the potential for increased revenue after the casino goes smoke-free? What have you found successful in getting that message across to casino managers or tribal leaders? Because we know that it probably will increase their attendance, and most people don't use commercial tobacco products. So I guess that's always just something I'm curious about, is what you're finding to be successful.
Yeah, I think during the pandemic, people were really, I think, like tribal leaders and communities, casinos were a lot more receptive to the message because of everything that was going on. And they wanted to hear like health benefits of going smoke free, even though, like even we would think it's, obvious, but just really like that's what drove a lot of their decision making and a lot of this home was bringing in stories from like workers, like on top of using data, right? But like bringing in the stories of the workers and, advocating for the public health of the community. Because, when I think about it, tribal leaders, they're elected officials. And when, at the end of the day, they want to like be able to serve their constituents and they care for their constituents. And so we made it about like community health and advocating for public health in the community using data to kind of drive home that message. And now it seems like, things are shifting again, where I don't think that much really, that's not like the main priority or the top focus. And so we do still want tribal leaders to see, these survey results and all these things that have happened and why it's so beneficial to go smoke free. And it is challenging to try to get that message across still. But I think what we're doing through like these types of webinars, through coalition that me and Colin are part of, Reclaim Sacred Tobacco, is I think like what I noticed during the pandemic is like we were all united on this front, and there was a lot of momentum in us working together to share information, to share data. And I think that's what we're trying to build right now through coalition, through like Reclaim Sacred Tobacco, and working with other organizations to be able to like take this template that we have and to do their own survey and just to bring information to their tribal leaders, to bring information to tribal communities about this issue. And I think like when it comes from the community, it's definitely, it's received a lot better when it comes from the community. It can't come from me, Colin, advocating, to a tribal community. It has to come from the community. And so that is like the focus of what we are doing right now, is working with these communities and having them kind of advocate for this, to collect their own data, present the data to the tribal leaders, and to make sure that like this issue is continuously being heard, and policies are voted on for smoke-free spaces. I do want to share something real quick that, kind of go back what Olin said. I was at a tribal council meeting one time during the pandemic, and I won't say what tribe, but it was really crazy because I remember the tribal leaders, they were advocating for smoke-free, for the casino to go 100% smoke-free. And I remember I was in the council meeting, and the casino operator, who was like the director, the manager for the casino, who was not a tribal member from our community, was telling our council, the importance of keeping the casino smoking during the pandemic, and saying like that, that we could just wear masks and smoke cigarettes through the masks. And I like, that's what was said. In everything that he was driving home was around the bottom line and profits, and saying that like this would be a huge mistake. And I remember I like interjected several times, and I said, at the end of the day, this is our decision from our tribal community and our tribal members. I said, I don't know why we're sitting here taking any advice from this person who's not from this community. And yeah, in the community, they move forward with a smoking policy, and the casino is now smoke free to this day. But like I said, I think it's like this narrative that still exists from casino operators that maybe all come from one type of school or have one type of background. They come in and, it's always that smoking needs to remain in casinos. And I think with data, with information, with all of this collaborative work, we are, we're doing something about that and changing that narrative. And that's what's important about all this.
Thank you. Nicole, did I see you unmute yourself earlier?
Can I weigh in?
Oh, sure.
There's a couple of points that if you're going to be working in the tribal community, anything related to tobacco reduction or even prevention work, most tribes have tobacco retailing as a subsistence funding stream. So keep that in mind. You may go to a reservation or a rancheria, and you're going to see a smoke shop. And even though the tribal leaders, don't smoke, or they don't like that, but if their casino maybe is not so big, but there's their subsistence funding stream coming from tobacco retailing is significant to them. So if you're talking to tribal folks about reduced tobacco use or going smoke free, be very cautious. I would just say, just be very cautious about how you approach that, because you're talking about subsistence and about money for food and for clothing and shoes, education, transportation. It's a significant thing. And another aspect of doing tobacco work in California is connected to something called the Master Settlement Agreement. You guys, I'm probably talking to the choir, but back in 1998, 38 of our nation's attorneys generals sued the major tobacco companies over the health impact cost in their states related to tobacco use and to predatory advertising in certain communities, like the Black community or the Native American community. Our imagery was used, and they were just targeting our people. So those attorneys generals, they were victorious in that litigation in the Master Settlement Agreement. And so consequently, a lot of funding flows to states that were part of this litigation. California is certainly no exception. As many millions of dollars comes in every year. So, but some of the fine print in the litigation requires the states to get a handle and try to stop what they call non-participating manufacturers of tobacco products. So that includes the Native American groups that are selling their own native-made products. So the state of California, and I was sent out to do that back when I was with the AG's office. This AG sent me out to talk with the tribes about stopping their tobacco sales, because it was related to the amount of money that the state got from the Master Settlement Agreement disbursement. And it infringed significantly on their sovereignty for their own economic development. And so there's I won't go into the details on that, but there's a lot of sensitivity in California with the tribes when you come and you mention anything about reducing. Again, it could be related to the Master Settlement Agreement. And that discussion caused a lot of controversy and a lot of friction between the state of California and the tribes. In fact, the whole thing was litigated, and there's a case, I think it's Bonta v. Big Sandy Rancheria. and it pretty much settled the question. But there's and it fell down in favor of the state's ability to reduce tribes' ability to import and retail tobacco products, but it did leave a lot of bad feelings out there about tobacco. So if you're doing tobacco prevention work, you might want to take the time to read up a little bit on Bonta v. Big Sandy Rancheria case, and please keep in mind too that tobacco retailing may be a subsistence fund for the tribe. So those two items, you might want to do a little bit of research on that, just so you know before you get out there, in the community.
Thank you. So there's a question that got submitted here just now. It asks, did the work with tribal casinos lead to tribal decision makers approving other smoke-free or prevention policy work? I think we got a similar question at part one, also just asking if any of this work led to other public health policy initiatives. Nicole, Colin, you want to, or anybody?
I can start. I don't know about anything off the top of my head specifically, but I think actually in reverse of that is important to think about. California is one of the few states that funds tribes directly to do commercial tobacco prevention work. So keeping that in mind, I mean, many tribes, or almost all throughout Indian country, have been kind of left out of the conversation, left out of funding from the master settlement agreement, like Olin was talking about. So oftentimes tribes do not have the same smoke-free policies for housing, for their government buildings, for health clinics, offices, other municipal things that may be on the reservation or in the community. So I think that by doing work like Nicole is doing at the Tribal Community Coordinating Center, getting out there and passing these policies is really an important step in working towards smoke-free casinos, starting with the more community-facing and community-centered programs and government buildings, and then we can begin to start to tackle the enterprises or the money-making operations that the tribes have. I guess that would just be my two cents, is what I'm seeing being helpful now that a state like California is funding tribal communities directly to do this.
Yeah,
Nicole?
I was just gonna, jump on and support Colin, is that when you talk about working in tobacco in California, Native American communities, as I mentioned in my blessing, we live parallel communities, so our communities don't overlap a lot. So the great strides that you're seeing with our other priority populations, African American, LGBTQ+, all of our other community they've had years of capacity building and getting policies and communities ready to make those smoke-free decisions. California tribes, this is brand new funding. Funding just started. The coordinating center wasn't funded until 2020, so it is very new. And so a lot of the early stages of informing our community, getting our housing directors, getting our economy, getting our councils on board, getting that education out there to build that, to look at an end game policy for tobacco is very far behind. So for us as people who work in tribal communities and to support them, that's what we're doing. These first years are education, housing, getting, Native Americans use at a higher percentage than any other minority in California. So it's getting the groundwork laid for us to start building those policies is very crucial, and especially in a culturally responsive way, making sure it comes from the Native community itself is really important. So we are capacity building, but we have made great strides in outdoor policies. Several of our funded tribes have passed outdoor smoke-free dance spaces, community buildings, and those kinds of things. So we are making our way there, but we're just a little bit behind other priority populations.
Thank you. And actually, first of all, Clinton just messaged us. He's had a conflict and had to run. So thank you to Clinton for the information he provided. It was very helpful. But your comment about cultural competence, relates to another question that we had at the last session. And it was just, what are some culturally competent elements that could be included in a tribal smoke-free casino policy? Is there anyone who'd like to tackle this one? Colin, you moved your head.
I can start again. I think we always defer to the community to tell us what to do if we at Public Health Law Center are helping write a policy. But some things that I've seen are, allowing space for smudging or use of traditional medicines in the casino, whereas somewhere like in a non-tribal setting, that stuff would kind of fall under maybe the definition of smoking. So we want to call those practices out. I think the other maybe easier win or easy win as far as cultural competence in a policy is to include language, traditional language, and then just reframing it. You heard Clinton talk about the Reclaim Sacred Tobacco Coalition. Instead of tobacco prevention, we're talking about reclaiming the traditional ways, traditional ceremonies and medicines that are used. So I think just reframing the language, using traditional or the tribe's language in a policy, and then making sure that we have exceptions or exemptions for traditional use or ceremony.
Thank you. Anyone else have a comment? Okay, one other question. I think this was directed to Olin. It's what has the reaction been when you've brought the idea of smoke-free casinos to tribal leaders? What are effective ways to get buy-in?
Well, so I think someone else mentioned, I didn't hit the issue head on because I knew I would get a comeback based upon the bottom line. So I continue to go at the issue from a health perspective. And many times, I've had conversations with folks that work in the casinos who have elevated cancer rates and or other tobacco related illnesses. And so they're very very clear about their wish to have a smoke-free work environment, and you can't deny that. So I kind of tastefully gently bring up a health impact, and that seems to be, to me, the best way to go. It's worked well for me.
Anyone else have a comment?
I think the importance of when you talk about smoke-free, and so tobacco is one of the very few revenue sources that California natives have been able to utilize for our social emotional welfare programs, our food programs on our reservation, our housing programs, our education programs for our young people. So it's not just about, the end game conversation is going to look very different in Indian country. It is going to look at excise taxes. It's going to, look at things that are more towards our bottom line, because this is, something that a lot of our Native communities, especially in rural California, rely on an income source to provide as those general needs. So it's never, I mean, you talk to anyone, we all know smoking is bad. We all know that Joe Camel needs to go, but the reality is that is a very fine line of where natives have control of what we have. So for Native communities, it has to be a conversation of capacity, transition, and bottom line adjustment. So you want us to stop selling tobacco, give us resources, give us communities, give us something to help transition, fund our small business coalitions or our economic development councils, come to us with practical solutions that can be implemented to transition those communities, because endgame looks very different in Indian country, and that's the reality of it. So don't say we can't do something without giving us the resources to transition away from those. And that's the one thing that's most culturally responsive, is understand that our resources are finite in Indian country. So we need help, capacity building, those kinds of things that help us transition away from that unhealthy model.
Thank you. That's great. We are approaching time here, and I think we've made it through the questions that we had. So I don't know if anybody has any kind of last thoughts they want to share on this topic before we go. No obligation.
It might be, if you're going to be working in the tribal community, it might be a great idea to engage someone from your local tribe, get some training and some information about the tribes in your area, about their history, about how their creation stories go. Just familiarize yourself with that community, make some friends, create some inroads. I think you guys probably in the county level already do that, but if you haven't, and I'm not talking about DEI, or I know there's a big push against that now. I get it, but we're talking about sovereign nations, and start learning some terms like sovereignty, self-determination, economic development, and what those mean to the tribe. If you learn that basic vocabulary, you will have, I think, an open pathway into that community to start working with them and start planting some seeds for some of these ideas that will produce results in the area of tobacco prevention for the casino and the community.
Thank you. I think that's a great final thought for this. So thank you so much, Colin, Olin, Nicole, and Clinton. I really appreciate all of you sharing your expertise on this really important public health topic. So stay tuned for future webinars from the Public Health Law Center, and hope you enjoy the rest of your day. So, thank you.
You guys have a great one.
Hi, thanks everyone.
C'est 10 heures le show.